Welcome to.
Sorry, go ahead, please.
Good evening, everybody, and welcome to second session on Masterclass. And we have a speaker, esteemed speaker, Ms. Priti Srivastava. She is going to deliver a masterclass on mental health, or we can say emotional well-being. Uh, we would like Priti ji to introduce, to give some background information about yourself.
Thank you, Manish, for having me here. I've been a corporate person for last 39 years, and my core has been advocacy. But my passion has always been working with the community through, non-profits and civil organization. Currently, I have two things very important in my life. One is to make sure that mental health gets his real due. And for that, I've started an initiative called DayaRani, which is a mental health think tank. Second is my profession. I'm Senior Vice President Advocacy with Reliance Industries. And through that, I'm mentoring a lot of young professionals. So that is my introduction. You all can find me by my name on Google. If you type DayaRani, you can find it on all social media. And a special thank you to the organization, and especially Manish for having me here. And a big thank you to whoever who has joined on a Saturday afternoon to listen to mental health. I think a big tap on your back for taking mental health seriously. Raghav, we can start.
Thank you.
Yeah. Before I start talking, some friendly reminders, housekeeping. Request you to kindly turn off your microphones and please type your questions in the chat box. And we'll be entertaining questions after my presentation is over. And also, it is very important to interact and listen to you. So question and answers is one of my favorite time during any masterclass. So please keep your questions ready, but it would be better if you can put it in the chat box. What is mental health? It is a state of mind. This one question has so much potential in itself because mental health is mostly misunderstood. Yes, it is a state of mind, or it is not. We will discover in next 2 minutes. Raghav, next. So first I'll tell you what is the definition of mental health officially by WHO. So they say that mental health is a state of well-being in which an individual realizes their own abilities, can cope up with normal stresses of life, work, productivity, and is able to make contributions to their community. It involves emotional, psychological, and social well-being, and it affects how people think, feel, and act. So this is the legal official definition of mental health globally. It has a second part. Next. And this is somewhat in what I believe. Mental health is not just the absence of mental disorders. It includes a range of factors, including the ability to manage stress, build and maintain relationships, make decisions, and adapt to change. It is dynamic and holistic concept that emphasizes the importance of mental and emotional resilience for overall quality of life. So if you decode it, it means that it is happening to you all the time. It is dynamic and holistic. When we say holistic, means it includes everything, what we feel, what we act, what we go through related to our health. And dynamic means it's in real time. Next. Now, when I started by saying that mental health for me and for most of us is more than a state of mind. Having a good mental health is more than absence of illness. Rather, it is a state of holistic well-being. I would like to explain it to you in my language. Over the years, I've had this conversation with a lot of people कि भाई mental health क्या है? So 90% of people, including me, when I didn't have the awareness and the research, felt that mental health ka matlab hai there's something wrong with me and I need help, which is absolutely wrong. Mental health is a term of your total well-being, जो हमने देखा, जो WHO ने बोला है. But what exactly is mental health and what is holistic well-being? When we say holistic well-being, it includes our mind, body, soul, the complete self, and uska wellness. I'll put it in another words. Your physical health is not just your holistic health. Your holistic health is your physical health, your emotional health, and most of the time what you think spiritually. Now, confusion कहाँ पे है कि हम मेंटल हेल्थ में जब हम सोचते हैं कि there's something wrong with me, वो एक्चुअली मेंटल इलनेस है, वो मेंटल हेल्थ कंप्लीट नहीं है. मेंटल इलनेसेस कि जब हमें ऐसी प्रॉब्लम्स हैं जिस पे हमें एक थेरेपिस्ट या साइकेट्रिस्ट की जरूरत है या कई बारी काउंसलर की भी, मतलब यू नीड हेल्प. That is mental illness. But unfortunately, this mental illness is understood when we start talking about mental health. And it is very important to understand because what I'm going to say ahead in the presentation, this becomes the foundation and the basis. So today, I would like to concentrate on emotional wellness. So जब भी हम मेंटल हेल्थ की बात करेंगे उसमें ज्यादा इमोशनल वेलनेस है, हमारी होलिस्टिक वेलबींग है, और एक पोर्शन है जो कि मेंटल इलनेस है. सो इफ वी अंडरस्टैंड दिस डिफरेंस, आई थिंक वी अंडरस्टैंड मेंटल हेल्थ टू अ लार्जर एक्सटेंट. नेक्स्ट.
Ma'am, we have a question from Mr. Prashant Bharadwaj.
Please. Is it in the chat box?
They raised the hand. Prashantji, do you want to?
I can't see. I can only see the presentation. I can't see anyone.
I've requested him to unmute and ask his question.
Yeah, please.
Prashant, do you want to ask your question, please?
Okay, I think we'll wait for later. He has stopped using his mobile phone for some. Should I continue or wait for Prashant?
I think he typed in the chat that he stopped using his mobile phone and
Yeah.
sometime. No, excellent point, Prashant. No, thanks a lot for sharing that perspective.
So I think we should understand, since it's a master class, what is the global scenario on mental health. So I've just picked up points on which I had a view. Globally, mental disorders have been one of the leading causes of disease burden. So when you type on a Google or any AI app about what is the status of mental health, there also it starts with the statement जो मैंने लिखा है, mental disorders. So somewhere traditionally, we have not tackled the language and the way we describe mental health. It also talks a little part of mental illness, which I said in the morning. But the important point, what I want to make here in the global scenario, and the positive one, is that all WHO member countries, India is part of it, are committed to implementing the comprehensive mental health action plan from 2013 to 2030. ये काम ऑलरेडी शुरू हो गया है 2013 में, एंड इसका ये जो पैक्ट है या जो WHO की रेगुलेशन है फॉर कंट्रीज, ये क्या कहती हैं? दे से दैट टू इम्प्रूव मेंटल हेल्थ बाय स्ट्रेंथनिंग इफेक्टिव लीडरशिप एंड गवर्नेंस, जो कि इंडिया में भरपूर है, प्रोवाइडिंग कॉम्प्रिहेंसिव इंटीग्रेटेड एंड रिस्पॉन्सिव कम्युनिटी बेस्ड केयर. मतलब कि आप लीडरशिप टॉप से मेंटल हेल्थ के बारे में पॉलिसीज बनाएगी, अवेयरनेस करेगी, एंड इट गोज डाउन टू द कम्युनिटी लेवल. जैसे हमारा, जस्ट टू गिव अ परफेक्ट एग्जांपल, जो एजुकेशन सिस्टम है, it starts at the top but it reaches right till the ground level. So this is what they want, a health system to be in every country. One sec, there's another question. I think I will take the question in the end. आप लोग लिखते रहिए. I will not get distracted by that. And राघव, इसको थोड़ा ऊपर करोगे, पूरी स्लाइड मेरे को नजर नहीं आ रही है.
Okay, yes, sorry about that.
Sorry guys for this little break in my talk. So I was saying that WHO has asked all the member countries. So this becomes the basis of the pact they have with these countries, and हमें 2030 तक क्या achieve करना है. And then we have to implement promotion and prevention strategies. We have to promote mental health in a very positive way in its real sense, and prevention strategy. कि भाई हम कोई भी mental disorder and any mental illness or any mental discomfort, I would like to use the word discomfort, इसको कैसे prevent कर सकते हैं as a country, and strengthen information systems. Information system is where we can reach out to the nation through various channel and provide the right information. Guidance, very important, through doctors, through medical institutes, through clinic, through the eco health system, which India is gearing up, and research. Research is very important because in any industry, you need data, you need research. Next. Everybody knows about SDG, but I will read it for you. The 17 Sustainable Development Goals adopted by world leaders in September 2015 set out a vision for a free world of poverty, hunger, disease, and want. SDG 3, Good Health and Well-being, calls on countries to ensure healthy lives and promote well-being for all ages. So we have a dedicated sustainable goal, number 3, which talks about good health and well-being. So good health, हम लोग समझते हैं सिर्फ हमारी physical health है, which is wrong, because when you say holistic health and when we say well-being, it is both emotional and physical. So next time, when we talk about our holistic health, when we talk about our well-being, we should make sure that we are considering our physical and our emotional health. Next. By just giving this global snapshot, मेरा एक ही मकसद था बताने के लिए कि भी ये जो हम मेंटल हेल्थ की बात कर रहे हैं, ये सिर्फ इंडिया का इशू नहीं है, इट इज अ ग्लोबल इशू. एंड जैसे सारी पॉलिसीज WHO बनाता है और मेंबर कंट्रीज जैसे G20 में साथ में आई थी, सो इट इज अ ग्लोबल इशू विच गोइंग टू बी टैकल्ड बाय सर्टेन लार्जर policies by these global organization and WHO. और हर country का अपना एक दायित्व है कि वो अपनी mental health policy या health policy में mental health को कैसे deal करना चाहती है, that is left to the individual country. And before I go to the next slide, now I would like to tell you a question a lot of people has been asking जब से ये master class advertise हुई है कि आपने ये टाइटल क्यों चुना. ये टाइटल इसलिए चुना है because I am 200% convinced people who are working in the mental health ecosystem in India and globally, they feel that we are sitting on an inactive volcano. It is going to be the next pandemic globally. Today, we call it a silent pandemic, but there is no doubt that it is going to come. And yesterday I was watching the program of Isha Foundation, and I was listening to Sadhguru, who also said this, that we need to take action now because globally and in India, we can feel, and there's enough data to prove that this is going to be the next big pandemic. Next. So therefore, this masterclass makes sense, and thanks for the organization who was, asked me to, give my views. Another thing before I speak is that whatever views I'm going to give, you believe this is personal, you have the discretion of disagreeing with me and please asking me any question at the end of the presentation. Due to COVID-19 pandemic, the number of anxiety and depressive disorder grew. इससे क्या हुआ? We all know the reasons, so I'm not getting into detail. इससे the word anxiety and depression उन लोग की जुबान पे भी आ गया जो जानते ही नहीं थे कि ये क्या है. Only a very elite class used to talk about depression and anxiety, but everybody globally and in India now knows what is anxiety, what is depression, what are other emotional disorders. Because the depressive symptoms grew from a base of about 193 million people worldwide to 246 million, which is about 28. Now, I want to say something. जो भी data मैं दे रही हूँ, obviously I've picked up from a reliable source, but ये numbers बहुत कम हैं. This is just to give you an idea कि ये जब हम पेंडेमिक बोल रहे हैं तो इसकी शुरुआत कितनी भयानक होगी अगर हमने इसको टैकल नहीं किया. Anxiety disorders grew from about 298 million people affected 374 million, which is about 20% increase as per WHO. But the problem is, जो मैंने बोला था पहले, research. All these data is based on research. And research have actually gone to people who have openly come out and declared कि हाँ हमें anxiety है, हमें depression है, हमें कोई we have an emotional issue. But what about people who haven't been reached and people who have not come out and opened about it? So I personally feel and want to say it very candidly here कि ये numbers बहुत कम है. The situation is really very alarming because of the definition I gave you. Mental health is not just mental illness. Mental health is also when we are not taking care of our emotional wellness. Next. This slide is just to give you an idea what I just said. 1 out of every 2 people in the world will develop a mental health disorder in their lifetime, according to a large-scale study co-led by researchers from Harvard Medical School and University of Queensland. On an average, just 2.1% of health expenditure. This expenditure goes to mental health across all low to whole high income countries. But ये funding और कितना expenditure है, I will take in another slide. I want to concentrate and continue what I was saying. 1 out of every 2 people. I'm making a statement that each one of us, when I say each and every individual globally goes through some kind of emotional disorders once in the lifetime. So I do not agree 1 out of 2 people because these are based on surveys. So when I say that it is a silent pandemic, I'm also saying that each one of us, including myself, at some point of time, need help. And if this is going to be more than COVID or like COVID, we need to take action now. And therefore, talking about mental health, understanding the gravity of the situation is really alarming. Next. Let's talk of India now. And this slide talks about Indian landscape of mental health. First, I want to tell कि government ने क्या किया था. India formulated its national mental health program in 1982. So yes, they had a vision that we need a mental health program. Then in 2014, they had a national mental health policy. The Mental Health Care Act bhi nikala 2017, which was passed on 7th April 2017 and came into force from 29 May 2018. So the positive outlook is that yes, there is a paper available, there is a guideline available, and government is very conscious that India needs a mental health program. Next slide. Just to give you an idea, and again, please see it just as a data, not as a realistic scenario. The scale of mental disorders in India is staggering, accounting to nearly 15% of global mental disorder burden. So, agar 15%, if this data is to be believed, globally, India se ja raha hai, so you can understand. And Indians are everywhere. So, I'm sure this is really big. And 15% of India's population is estimated to be suffering from mental disorder. I agree and I disagree. I agree that 14% are people who need help, who need medicines, who need specialized therapists. But I don't believe that, only 40%. When I'm saying all of us at some point of time face emotional issues, which is a part of our holistic well-being, which is a part of mental health, which means that we all need to take care of our health. Otherwise, we will not be able to stop the silent pandemic, which may hit, I don't know when, but very soon. When I was making this presentation and it was based on research, funding keep coming back. That's why it is in so many of my slides. This will just give you an idea. I just spoke that, Indian government has a policy. But look at the other side of the story. 0.1% is the total mental health allocation in the health budget over the last 5 years, which is approximately 5% allocation if you compare to the developing countries. मतलब बाकी जितनी डेवलपिंग कंट्रीज हैं जो कि बहुत कॉन्शियस है कि हमें मेंटल हेल्थ पे बात करना, उनका एलोकेशन 5% है, जो कि बहुत ही कम है. लेकिन इंडिया में तो 0.1% है. So what's an advocacy person in me thinks, yes, हमने पॉलिसी बनाई, हमने गाइडलाइंस बनाई, बहुत अच्छा किया, लेकिन हमने उसको इम्प्लीमेंट नहीं किया. क्योंकि अगर हम उसको इम्प्लीमेंट करते तो ये फिगर कम से कम 25% ऑफ होना ही चाहिए था हेल्थ बजट का मिनिमम. बट देयर आर इश्यूज, देयर आर की चैलेंजेस जो कि आगे की स्लाइड्स में है, बट दैट जस्ट गिव्स यू एन आइडिया. एंड 2019 से लेके 2020 तक, क्योंकि उसके बाद का डेटा अवेलेबल ही नहीं है, 40 करोड़ अगर हेल्थ मिनिस्ट्री को मिला मेंटल हेल्थ पे, उसमें सिर्फ 2.5 करोड़ ही स्पेंड हुआ था. This figure must have increased during COVID, but the data is not available. Next. Let me come to my favorite and the most important slide in my entire presentation, which is my top key challenge. It is awareness. इस पे जितना बोलूं कम है, but in the limited time I have, I'll just give you bullet points. There is a lack of mental health literacy and basic awareness on what is mental health, जिसके बारे में मैं बात कर चुकी हूँ. What constitute mental illness and how to treat it. इस बारे में हमें बताया ही नहीं जाता. The inability and difficulty in recognizing sign systems of mental health disorder makes it difficult to acknowledge their presence. जो मैं आपको पहले कह रही थी कि अगर मेरे को एंजाइटी होती है, डिप्रेशन होता है, फियर साइकोसिस है, लोनलीनेस लगता है, दैट डजंट मीन कि मेरे को कोई मेंटल डिसऑर्डर है. दीज आर वेरियस इमोशंस व्हिच ऑल ऑफ अस फील. The only problem is कि जब ये थोड़ी ज्यादा हो जाती हैं, बहुत जल्दी जल्दी फ्रीक्वेंसी में होती हैं, and it starts affecting our life and our work, it is then we realize कि we need help, जिसके बारे में आगे बात करूंगी. That doesn't mean कि हमें कोई mental health disorder है. तो सबसे ज्यादा अवेयरनेस हमें इस चीज का है ना कि भाई मेंटल हेल्थ है क्या. Additionally, mental health is not publicized like other non-communicable ailments. Very true. कितने एडवर्टीजमेंट हैं और कितने बिलबोर्ड्स हैं और कितने वर्कशॉप्स होते हैं, कितनी किताबें स्कूल में या आगे पढ़ने को मिलती हैं. I don't have to say, you have the answer. तो अवेयरनेस पे पूरा लेक्चर हो सकता है, but I will leave it here. फिर diagnosis is constrained due to limited capacity and lack of access to mental health professionals, especially in rural India. I'll talk about some data in my next slide. Next, please. Key challenges हमारे continue हैं. This photo has been taken from a live demonstration. No health without mental health. जो मैं कहती आपका अगर आप mental health नहीं tackle कर रहे, you're not tackling health. Stigma surrounding mental health issue. इतने ज्यादा स्टिग्मास हैं. सबसे बड़ा स्टिग्मा तो यही है कि भाई मेंटल हेल्थ है क्या. डिफरेंस बिटवीन माई इमोशनल वेलनेस और मेंटल इलनेस हमें मालूम ही नहीं है. हमने सबको वन साइज फिट ऑल बोल दिया. कुछ मेरे को एंजाइटी है मतलब मेरे को मेंटल हेल्थ इश्यू है. तो सबसे पहले तो हमें ये स्टिग्मा हटाना है. सेकेंड, कल्चरल टैबूज एंड रिलक्टेंस टू डिस्कस इमोशंस. We don't come out. We don't even talk to our dear ones. We don't even talk to our family. And I will go ahead based on my experiences. We are fearful for even telling ourselves that I need help. Even recognizing, we want to ignore, we want to, put it under the carpet. It is cultural and personal too. Impact on seeing help and treatment. सबसे बड़ा स्टिग्मा ये है कि अगर मैं किसी के पास गए, डॉक्टर थेरेपिस्ट के पास, और सीक रही हूँ ट्रीटमेंट देगा, इट विल बिकम ओपन. सबको पता चल जाएगा कि there's something wrong with me. And that's what I'm repeating again and again, that it is not a mental disorder. Your anxiety, your fear, knowledge, these are normal emotions which all help, and only you need treatment because you need a good health. हमें बीपी होता है, हम चेक करते हैं, डॉक्टर के पास जाते हैं, कोई भी प्रॉब्लम होती है, हम अपना पूरा मेडिकल टेस्ट कराते हैं, बोलते हैं हमने तो कंप्लीट टेस्ट कराया है. We don't talk about emotions and wellness and our anxiety. So the biggest stigma is that mental health is not part of our health system, in our thought process, in our implementation and treatment of health. Next. Due to disappropriate emphasis on biomedical approach, there's lack of focus on psychological interventions. Furthermore, there's no holistic approach to care delivery. इसका मतलब ये है कि हम जब किसी थेरेपिस्ट के पास जाते हैं, so there are therapists, there are counselors, there are psychologists, and there are psychiatrists. आपको हमारे यहाँ इंडिया में ये डिफरेंशिएशन, ये अवेयरनेस ही नहीं है कि कौन किसके पास जाएगा. So before you reach the counselor, there are a lot of people you can meet and you can get your problem sorted. But वो system ही ऐसे नहीं बनाया है. So it's a problem with the health ecosystem in India, which is the next. Lack of support structures for family and caregivers of the patients. कि अगर फैमिली में कोई प्रॉब्लम है, आपका जो डॉक्टर है, जो आपका फैमिली डॉक्टर है, he should be able to treat you half the things, which we'll talk if you have any question answers, which I see are coming. Furthermore, there's lack of holistic mental health support structure in corporates. Corporate में इसलिए करा, मैं खुद एक corporate से आती हूँ. Most of the people here in corporates, under the employee scheme, health checkup का benefit देते हैं, reimbursement देते हैं, but nobody has ever thought or decided or implemented any checkup or any talk about getting your emotional wellness checked. Next. इतने सारे challenges हैं that I'm going fast. The National Mental Health Act 2007 is a progressive act. However, its implementation and adoption have been limited. I've covered it. Act है, implementation नहीं हुआ. Lack of mental health boards at the state and district level to drive the agenda. Our current government has done a fantastic job, because what they've done is from center to state to district to even a panchayat level teluka ऐसे implement होता है. The same thing we need from mental health. So we have the system, we have the process. हमें सिर्फ mental wellness का awareness और treatment push करना है. Further, the government's focus on regulation and implementation of the act has been limited. मैं इसकी detail में नहीं जा रही हूँ, which just means that we need to redefine and restructure and update our Mental Health Act and policy. Although the Mental Health Act mandates insurance provider, ये important है, to cover mental health along the same lines of physical illness, poor implementation and enforcement has resulted in lack of insurance cover for patients. A lot of people come to me and say कि हमें कोई भी mental health treatment का insurance नहीं मिल रहा, ना corporate कर रहा है, ना insurance company. And this is just one example I've given, जो कि हमारे एक्ट में है बट इंप्लीमेंट नहीं हो रहा क्योंकि nobody is implementing the governance side of this act and policy. Next. Inadequate focus. The capacity building is limited due to inadequate focus on mental health in the medical curriculum. मतलब हमारा जो मेडिकल करिकुलम है उसी में फोकस नहीं डाला तो चीजें आगे कैसे बढ़ेंगी. This dearth of institutions carrying out research on mental health. Manish ji knows I'm still struggling to find research institutes on mental health. क्योंकि अगर रिसर्च नहीं होगी हमें डेटा नहीं मिलेगा, हमें डेटा नहीं मिलेगा, हमारी पॉलिसीज नहीं बनेगा और हमें ये नहीं पता चलेगा कि हमें क्या करना है. लैक ऑफ लॉन्ग टर्म फंडिंग, इसकी बात कर चुके हैं. अभी तो हम फंडिंग तो बाद में आता है, गवर्नमेंट की तरफ से आपने देख लिए, प्राइवेट इंस्टीट्यूशंस की तरफ से भी कुछ भी फंडिंग में नहीं है. अंडर CSR कर सकते हैं बट इट इज नॉट हैपनिंग. नेक्स्ट. ये स्लाइड मैंने इसलिए डाला है जो मैं आपको डिफरेंस बताती थी कि भी मेंटल इलनेस के भी हमने बड़े डेटा आते हैं 14%, 15%. इंडिया में इतने लोग डिप्रेस हैं, इतने लोगों को डिसऑर्डर्स है. इमोशनल, हमारा जो इमोशनल डिस्टर्बेंस है, सबसे ज्यादा केसेस अगर आज पूरे इंडिया का रिसर्च हो जाता है, मैजिक बॉन्ड आ जाता है, हमने सबको स्क्रीन करा, ये सबसे ज्यादा रीजंस है. प्रेशर फ्रॉम एकेडमिक एंड प्रोफेशनल परस्यूट्स. द नंबर ऑफ सुसाइड सबसे ज्यादा कहाँ है? स्टूडेंट लाइफ में. सबसे ज्यादा डिप्रेशन और एंजाइटी कहाँ है? प्रोफेशनल्स को, बिकॉज ऑफ नो जॉब्स, corporate issues, the list is long. Economic challenges and job related stretch, I've covered. Education and career, these are the industries जहाँ पे सबसे ज्यादा फोकस होना चाहिए मेंटल हेल्थ पॉलिसी इम्प्लीमेंटेशन का. फास्ट पेस अर्बन लाइफ कंट्रीब्यूटिंग टू स्ट्रेस. पूरा लेक्चर हो सकता है कि हमने अपनी ये जो सोशल मीडिया की और टेक्नोलॉजी की एक पूरी नई दुनिया बना दी है, उसके फायदे बहुत हैं, बट हमारे मेंटल हेल्थ पे इसका क्या असर है उसके बारे में बात नहीं करते. अगर हम एज अ टेक्नोलॉजी कंट्री आगे बढ़ रहे हैं तो हमें उसके साइड इफेक्ट्स को भी अवेयर करके लोगों को बताना है. आई एम अ वर्किंग पर्सन, 24/7 मेरे को ऑनलाइन है, बट आई नो मेरे को कब फुल स्टॉप लगाना है, क्या करना है. सो आपको प्रिवेंशन भी देना है साथ में, अदरवाइज योर एंजाइटी एंड डिप्रेशन केसेस विल कीप राइजिंग. दीज आर रियली, अगर आप स्क्रीन करें इंडिया को, वी आर नॉट अ डिप्रेस कंट्री एज मोस्ट डेटा एंड रिसर्चेस वर्ल्ड वाइड से. इंडिया का कोई ऐसा रिसर्च नहीं है. अगर हम इन पे फोकस कर गए और इन पे प्रिवेंशन दे लें, वी आर ऑलमोस्ट सॉर्टेड. नेक्स्ट. कॉल टू ऑर्डर. हमें, मेरे हिसाब से, प्रीति के हिसाब से क्या करना चाहिए? हमें रिव्यू करना चाहिए अपनी पॉलिसीज का, रिफाइंड एक्शन प्लान कि हमें पॉलिसी को कैसे इंप्लीमेंट करना है, क्या इकोसिस्टम बनाना है, और क्लियर डिलीवरेबल्स ऑफ एग्जिस्टिंग मेंटल हेल्थ पॉलिसीज इन इंडिया. कि क्लियर हमारे पास स्ट्रक्चर बना है. हमें अभी तो वी आर स्ट्रगलिंग विद हॉस्पिटल्स, but for mental health you don't need so many hospitals. Mental health awareness के लिए you need people, qualified people. So what we need more streams in medical education जो कि mental health पढ़े, समझे, and कोई ऐसा बाउंडिंग नहीं होना चाहिए कि आपको पोस्ट ग्रेजुएशन करना है, आपको PhD करना है. There has to be a 3-year course. उसके बाद आप कम्युनिटी में जाके लोगों की हेल्प कर सकते हो. वी नीड टू इंक्रीज थेरेपीज. फंडिंग मैं टच नहीं करी, मैंने बहुत बोल दिया, बट इट इज अ कॉल टू ऑर्डर, इसलिए यहाँ पे है. एडवोकेसी फॉर मेंटल हेल्थ एज अ पब्लिक हेल्थ प्रायोरिटी. This is my job as an advocacy person, but it has to be spoken at all the forum within the country, within organizations, within our houses, that how important public health priority. इसको pandemic से हट के priority अगर हम बना देंगे, then it will be tackled. पब्लिक प्राइवेट पार्टनरशिप, मैंने आपको फंडिंग की बात बोली, गवर्नमेंट के पास मैं मान लेती हूँ दे हैव बिगर प्रॉब्लम्स टू हैंडल, तो हमें मेंटल हेल्थ पे ये एटीट्यूड छोड़ना पड़ेगा कि गवर्नमेंट ही सब करेगी. Why can't corporates under the CSR, under their employee engagement programs, come and take actions for their employees? Setting real life examples. I think we need more and more people to come out in open and talk about their experiences and tell people that it's okay not to be okay. कि अगर आपको एंजाइटी है, डिप्रेशन है, फियर है, तो ये नॉर्मल है, सबको होता है, doesn't mean you're mentally ill. Next. I thought I will leave everybody with a very, very positive note, which I call light at the end of the tunnel. इंडिया कितनी डिजिटल है, कितनी टेक्नोलॉजी सेविंग हो गई है, एवरीबडी नोज. So Government of India has recently launched Ayushman Bharat Digital Mission, which aims to create a platform enabling health data within the health ecosystem as to create electronic health records for every citizen. Technology is available, it is AI based, एंड मिनिस्ट्री ऑफ हेल्थ ने डेजिग्नेट भी कर दिया है, यहाँ पे नाम है अंडर द आर्टिफिशियल इंटेलिजेंस. जस्ट फॉर इंफॉर्मेशन, इंडिया आफ्टर G20 इज लीडिंग द AI रेवोल्यूशन ग्लोबली. सो जब हम लीड कर रहे हैं, सो व्हाट वी नीड टू डू, एंड टेक्नोलॉजी इज अवेलेबल, कि आपको अगर स्क्रीन करना है, आपको रिसर्च करना है, आपको डेटा चाहिए, तो साइंटिफिकली आर्टिफिशियल इंटेलिजेंस के थ्रू इट इज पॉसिबल. I think, Raghav, I want to end and I want to interact with people and answer the questions. Because there's so much to say, but I think interaction is the best. So can we take questions? It will be good whoever has said, if they can just interact and talk to me.
No, thanks, ma'am. I think there was a question from Mukesh. Mr. Mukesh, do you want to unmute and ask a question?
Yeah, please go ahead.
Yeah, hello Priti ji.
Hi
Namaste.
Mukesh ji. Namaste. कैसे हैं आप?
I'm good. So anxiety and tension, these are very common in everybody's life, right? So being accepted as a mental issues, how it is there as far as India is concerned.
See, मैं तो उल्टा जा रही हूँ, मैं कह रही हूँ कि एंजाइटी और पैनिक अटैक्स या फियर, एक आपने क्या बोला, टेंशन, ये मेंटल हेल्थ इश्यूज है ही नहीं द वे वी अंडरस्टैंड. दिस इज अ वे ऑफ लाइफ. हमारे कितने एक्सटर्नल फैक्टर्स हैं जिसकी वजह से हमें एंजाइटी और टेंशन होता है. So what we need to do, and that's what I'm saying, that rather than making into a big mental health issue, it is a lifestyle issue, and we have to tackle it ourselves through changes in our mindset, through a lot of tools which we can talk offline, and this should not go as a mental health disorder. We need to redefine the way we think about mental health and not think as a taboo. मैंने बोला ना, it's okay not to be okay. सबको anxiety होती है, सबको tension होता है. There are tools and methods to take them away. But
Correct.
we cannot put it as a national mental health taboo and stigma.
Correct.
Thank
Actually,
you.
many times, particularly if you see even schooling time during the examination, whenever any parents reach to the psychiatrist and other thing, so they talk about, oh, you have a tension, so they create more tension than resolving the tension kind of thing there. So you rightly mentioned a lot of awareness is required, and awareness from the known scientific data, so that is the most important thing.
वो इसीलिए मैंने एंड में बोला टेक्नोलॉजी अवेलेबल है, वी जस्ट नीड द विल ऑफ द गवर्नमेंट एंड विल ऑफ द कॉर्पोरेट्स टू टेक इट अहेड.
Just to add you, we in fact, we have done some survey because I have a company that dealing with healthcare chatbot, and recently we have launched, in fact, a mental health chatbot also with few of the clinics. So, including like psychiatrists and therapists, because many times they too much emphasize in front of the patient, their parents, so they indirectly they are inducing more anxiety and tension rather than they're saying okay to be not okay what you have mentioned right now.
प्रॉब्लम क्या है, आई हैव दिस डेटा हियर कि हर 1 लाख की पॉपुलेशन पे इंडिया में 0.3 साइकेट्रिस्ट हैं. बट मैं ये कह रही हूँ हमें साइकेट्रिस्ट की जरूरत ही नहीं है. हमें क्या चाहिए, हमें काउंसलर्स चाहिए, हमें थेरेपिस्ट चाहिए. एंड ये हमारे जो अगर गवर्नमेंट एंड दिस विल बी सच अ गुड प्रोफेशन एंड जॉब अपॉर्चुनिटीज फॉर पीपल. जैसे मैं हमेशा एग्जांपल देती हूँ, आशा वर्कर्स हैं, दे डिड अ फैंटास्टिक जॉब ड्यूरिंग कोविड. व्हाई कांट वी ट्रेन द आशा वर्कर्स और सिमिलर? बिकॉज वी हैव टू पेनिट्रेट इंडिया, वी हैव टू मूव वेरी फास्ट.
Correct. Yeah, that's it. Thank you. Thank you. No more question from my side.
Anybody else?
Mr. Prashant, I think he dropped out.
Pooja wanted to ask something.
Yeah,
Go ahead.
yeah, ma'am. Hello. Yeah,
Yeah.
ma'am, I just wanted to understand how can we contribute to spread awareness on mental health as an individual? Like, how can we do that?
Yeah, okay. I think we have to start first thing from ourselves. Firstly, as individuals, we need to be very conscious कि हम किस state of mind में, are we taking care of our holistic health? Are we taking care of our emotional health? Because जो हम personally experience करते हैं and जिसके बारे में हम convinced है, then we can tell. So I think as an individual, we should start from ourselves, then go to our family. After curing them, we should go to the community. And मैंने बोला था ना, we need more examples. So if जितने लोग mental health, sorry, emotional wellness की बात करेंगे, mental health, या आज के बाद हम बोलेंगे emotional wellness के बारे में बात करेंगे on social media, in kitty parties, in everywhere, in all forums, तभी ये debate शुरू होगा. We need to start a debate on awareness. So the only way is people have to lead by example. They have to talk about their own lives. And they have to make sure that the stigma goes. Stigma इसलिए नहीं जा रहा क्योंकि हमारे पास examples ही नहीं है ना, हमारे पास data ही नहीं है.
Right. But ma'am, what I have understood that people that take it as a taboo, that's true. And the young generation also is doing the same. I have an example of a child who was taking some, counseling sessions from a psychiatrist. And then, a group of friends came to know about it. And then it's become a huge thing. She's not able to face anybody because they keep chasing her or disrespecting her, that you take sessions and all. How to get over with that? And because of that, now she feels that she's done a wrong. She's going to a psychiatrist. It's a very bad thing. And I'm talking about the young generation, 19 years old girl who had this was going through this all that. So how to manage that?
Thanks, Pooja. Very valid question. ये एक दिन में तो होगा नहीं, अभी तो ये फेस करना पड़ेगा क्योंकि सोसाइटी में टैबू और स्टिग्मा है. इसीलिए मैं कह रही हूँ कि वी आर ऑलरेडी लेट. मतलब येस्टरडे बेसिस पे कैसे काम करें मुझे भी नहीं मालूम, बट इट इज दैट अर्जेंट. So only when we start talking, it's a number game, multiplication game खेलना है हमको कि 1 से 2, 2 से 4, 4 से 8. It has to spread. This awareness has to spread like an infection. तभी हम लोग टैकल कर पाएंगे. अदरवाइज ये इतना डीप रूटेड है और इतने सालों से है कि एकदम तो नहीं. बट इट्स ऑलवेज one step start to any journey.
Right.
Ma'am, I also had a question. Very nice presentation.
Yeah, please.
Thank you, ma'am.
Question
Thank you so
was, you
much.
mentioned about awareness and that stigma.
हाँ.
Is it due to, and this is my hypothesis, is it due to the reason that mental health is more of a subjective topic and there are not enough adequate objective measures? Let's say with physical health, there are so many checkups, like I can get my hemoglobin to blood pressure to various sorts of protein checkup and all those stuff, as well as other, like if I have a fever, I can get an objective measure that how much fever I have. Versus mental health do not have that much of an objective measures to look at, and it's become very subjective.
वेरी ट्रू राघव. दो रीजन है. एक तो है कि मेंटल हेल्थ के बारे में कभी बात ही नहीं करेंगे. अब आम आदमी या कोई रिसर्चर वो देखता है गवर्नमेंट तो हेल्थ बजट में 0.1% दे रही है, क्योंकि तो ये शायद इतना प्रायोरिटी इशू नहीं है. तो एक हम लोग के दिमाग में बैठ गया कि प्रायोरिटी इशू नहीं है इंडिया के लिए. दूसरा है कि कभी हमें पढ़ाया नहीं गया, कभी सिखाया ही नहीं गया कि आपकी ओवरऑल होलिस्टिक हेल्थ में आपकी इमोशनल हेल्थ भी इंक्लूडेड है. तो जो चीज हमने सीखी नहीं है उस पे यकीन करना बहुत मुश्किल है. तीसरा जो आपने बात करी स्क्रीनिंग की, टेक्नोलॉजी अभी आई है. मनीष जी एंड आई वी आर वर्किंग ऑन इट. आई कैन ओनली से इट इज पॉसिबल, बट उसको ले जाना लोगों तक, और यही बहुत बड़ा अवेयरनेस का काम है कि भैया टेक्नोलॉजी अवेलेबल है. आप अपने आप को जैसे अब अपना जैसे मैं एग्जांपल देती हूँ, कोविड में आप अपना टेस्ट किया घर पे और आपको पता चल गया कि आपको कोविड है कि नहीं. इसी तरह टूल है एआई बेस्ड. घर बैठ के आप एज एन इंडिविजुअल वो आपको एम्पावर करता है कि आप अपनी इमोशनल वेलनेस स्क्रीन करें, डायग्नोज करें, और उसके बाद यू टेक अ कॉल कि आपको हेल्प की जरूरत है कि नहीं. एंड दैट इज द बिगेस्ट अवेयरनेस वी नीड टू स्प्रेड. So there are a lot of reasons. It's like ये बहुत बड़ा जिसे कहते हैं ना, एक तरह से हमें मेंटल हेल्थ का मंथन करना पड़ेगा, उसमें से सब चीजें निकलेंगी. It's that big a problem.
Definitely.
In fact, Raghav, we had a discussion almost 1.5 weeks back, and we found out, like, the way we are developing the genomics, at rather placing genomics at the center stage of, therapies and all, the same way we need to place mental health also.
Absolutely.
And that's a paradigm shift. I think all of us need to work together and drive this message across the whole health ecosystem.
Yeah.
Definitely.
So we can maybe call mental health or well economics or mental economics, whatever, whichever way. Actually, the way we have, worked out that term, we have coined this word genomics.
Yeah.
It's much grave, actually. I keep reading about, I mean, look at the core of most of the crimes. Priti ji, if I'm not mistaken, if we carry out a survey of crimes being committed these days and all, they have a very very significant portion of these criminals being stressed or whatever. Like, most of the crimes are not done by first time by professional criminals.
Absolutely.
Yeah. No.
बिल्कुल, इट्स अ वेरी बिग इशू. सबसे बड़ा पॉइंट तो ये है कि पीपल लाइक अस, Manish ji, who are so passionate and who can see a pandemic coming, how to convey this to people. A lot of people said, oh, we want to be part of the masterclass, but हमारा Women's Day celebration है या Saturday है या कुछ है. And I don't blame them, क्योंकि उन्हें लगता ही नहीं कि ये इतना अर्जेंट इशू है कि हमें समझना चाहिए, डिस्कस करना चाहिए.
Back home, if they
अभी
speak
मैंने
to
I'm giving
their
it away कि ये तो मंथन ही करना पड़ेगा.
back home, if they speak to their parents, their children, they'll discover, like, at least one or two such cases they'll find in their backdrop, so
Yeah,
it's really actually alarming.
Yeah. There's a question also, I think, from another participant. I've requested, named iPhone. Sir, ma'am, can you please?
That's me, Kanika. Sorry, I haven't changed
Yeah,
the name
Kanika can.
of my
Yeah, hi
iPhone.
Kanika.
Hi,
Good to have you
good
here.
afternoon. Hello, ma'am, and hello, everyone. I think congratulations. I think this is a brilliant. I mean, this is not an initiative; it's the need of the hour. I had a point and a question to make both. I also think on the point of awareness. I think we're going to the other end of also wrong kind of awareness simply because of the access to information on social media, right? Also, number two, new age mental health practitioners coming up or wannabe practitioners coming up, education, so 499 course or a 5,000 rupee course on a Udemy for 1 hour can get you a Yale certificate for being a life coach, right? So there is so much of information out there which is absolutely based on a whim, what somebody is feeling or what they might have experienced rather than actual data. I mean, a regular person studying psychology spends a basic of 5 years studying it. So I think the awareness is going into a completely wrong direction because mental wellness is being made a business. There is a business and people are making that a bigger priority than actually the issue at hand and the study it requires. So how do you think, all of you who are so professionally inclined towards it, how does one control that, right? So I mean, you have, with all due respect to everybody who's trying to do this, whether it's an NLP practitioner, whether it's new age holistic, I follow so many on Instagram, and half the time I feel like whatever I'm reading I can relate to it. But maybe we are at an age where there's a maturity to draw a line. However, the youth is going crazy. Every second person in the age of 19 to 30 is using words like I'm depressed, or I have I'm going through a mental health issue. People are also misusing that. So I think it's equally important to maybe have some control issues of what is legit mental health and what is not legit mental health. Like you said, anxiety panic attack is not a mental health issue, it's a way of life, it's a feeling. But it's so skewed. So I feel like awareness of the wrong kind is on the rise with the people who are wannabe therapists. And unfortunately, there are many vulnerable people out there. So, how do you think we could come up with control methods to say, ye legit hai or ye galat hai? People I know are publishing books, saying we are life coaches. How are you a life coach? So this is quite scary and disturbing. So I just want to know, how do we do something about that?
Kanika, you couldn't have raised a more important issue. सी आई डोंट नो हाउ टू आंसर इट, बट जैसे मैंने बोला, एक्ट गवर्नमेंट का काम था, एक्ट बना दिया, पॉलिसी उसको अपग्रेड नहीं करा, उसको इम्प्लीमेंट नहीं करा, और फंड्स एलोकेट नहीं करे. सो समवेयर वी आर लाइक अ हेडलेस ऑर्गेनाइजेशन. इफ आई टॉक इन टर्म्स ऑफ द कंट्री, we need focus, we need the right kind of leadership, and सबसे ज्यादा regulators. We need regulation and policy first to define क्या है, second to control the market. It's like a free market. कोई भी आके बोल
Yes.
देता है कि I'm a life coach is every second person I meet is a life coach. तो बहुत it's a very big issue, and my फियर इज कि जब ये आएगा सुनामी की तरह, हम लोग प्रिपेयर्ड नहीं होंगे. हम एंड ये पहली बार है कि हमें मालूम है कि खतरा आ रहा है, लेकिन हम कुछ नहीं कर रहे, हम आंख मीच के बैठे हैं. सो पीपल लाइक आज, यू, मनीष जी, हम लोग अपने इंडिविजुअल लेवल पे, it's not even a drop in an ocean. And when I said a lot of people promised and they didn't come for the master class, is exactly because I said क्या सुनना, it is not an issue.
Yes, correct.
एंड मेंटल, जब तक हम उसकी डेफिनेशन नहीं चेंज करेंगे नहीं होगा. एंड जस्ट टू गिव यू एन एग्जांपल, इवन एट द गवर्नमेंट लेवल व्हेन आई स्पीक टू पीपल, WHO ने बोला था कि इंडिया 2-3 साल में अबाउट 1 to 1.3 ट्रिलियन USD का लॉस होगा इकोनॉमिक
My
रिफॉर्म्स
God.
में.
Right,
बट
right.
कोई सोचता ही नहीं ना. इफ आई एम अ हैप्पी एम्प्लॉय I'll give more. It will contribute to my ROI.
Right.
बट वो कह रहे हैं ना, वो पिरामिड जो हम मार्केटिंग में बात करते हैं इकोसिस्टम, वो है ही नहीं. इट्स अ हेडलेस ऑर्गेनाइजेशन. हर सो एनीबडी कैन क्लेम एंड डू एनीथिंग. इट हैज टू, वी नीड अ प्रॉपर स्ट्रक्चर टू इट, which unfortunately is not there. You go to the health ministry and you see how many people Manish ji knows are there in the mental health department. तो ये feeling आ रहा है. But on the other hand, it has become a fad to talk about mental health and giving wrong awareness, as you just said. And people feel कि ऐसे करने से उनका business, it's like a shop they are running. But individuals like us cannot stop it. It has to be government. And my wish list is that जो screening है, emotional wellness का screening, that has to be made mandatory, because in India every policy is made based on research and data. So
Correct.
हम लोग कितना भी बात कर ले, it has to be one step leading to the other.
Right. Thank you.
Thank you,
Thank you.
Karnika.
When we are right at time, any last comments or questions from anyone in the group?
I think it was nice interacting with people, and I think एक और नारा होना चाहिए. I was just reading कि हमें empathy scale बढ़ाना चाहिए लोगों का. जैसे वो कहते थे ना, positivity quotient. People talk of IQs. I think we should talk about empathy, because if we increase empathy, then we will realize that कितना important है mental health. So चाहे छोटा ही group है, but a lot of work needs to be done. And I think all of us are ready for it. Thank you very much, Manish ji, for this opportunity once again.
Thank you, everyone.
Manish,
Thank
sir,
you.
you're on mute.
Thank you, everyone. Thank you, ma'am.
Thank
Manish,
you.
sir, you're on mute. Manish, sir, you're on mute.
Manish ji, सुनाई नहीं दिया, mute पे थे.
Yeah, okay. Well, thank you everybody being part of this very interesting and very interactive session. And a lot of inputs I could gather from your presentation. And certainly we need to work as a cohesive team. I'm talking about all concerned stakeholders. We have to take it forward.
Yes,
we
we
just
have to
cannot
take.
brush it
We should
under
not
the
get
carpet.
discouraged by कि कोई सुन नहीं रहा है. I mean, we should keep continue doing our work.
It's a wonderful presentation, and I was really alarmed when you said like just 0.1 or 2% of the total health spend is spent on.
Yes.
We need a paradigm shift. So let's join hands together and let's do it. Yeah.
Sure.
Thank
Always
you, everybody.
there. Yeah.
Thank you,
Thank you.
everybody.
Thank you, Shekhar. Thank you, Raghav. Thank you, everyone.